So my presentation talked about the role of radiation therapy with immunotherapy. So immunotherapy has emerged as the greatest novel treatment for cancer today. However, the approaches with immunotherapy affect only a minimal number of patients, and the results could be short-lived. So we explored today how the role of radiation can add to the benefits of immunotherapy, or vice versa, how immunotherapy can add to radiation. So radiation therapy in and of itself as a monotherapy can stimulate the immune system. It does that in a number of ways. One, it can increase what's called the major histocompatibility complex, or MCH. And it does that. The MCH picks up the tumor antigens and they present them to the T cells that say, hello, I'm sick, come help me. Radiation does a very big part in making the MHC visible. Tumors are very good at hiding it or suppressing it, where radiation can play a very important part in making it visible so that the tumor can pick up the antigen so that the immune system knows that it's sick and can wage an attack on the cancer cells. Radiation is very important because it causes what's called an abscopal effect. Abscopal comes from the term target and a distant, so abscopal, distant target. Radiation causes such an immune response by destroying a tumor that it wages a war on cells that are elsewhere in the body. So a tumor, if we treat something in the lung, we treat it locally with a high dose of radiation, it elicits an immune response. Those immune cells then go and target tumors elsewhere in the body. Well, when we combine therapies, sometimes we're combining toxicities. We saw this in case with radiation and chemotherapy. Putting the two together sometimes combine the toxicities in these patients. This becomes very important for oncology patients as we start to combine immunotherapy with radiation therapy. We may see a rise in toxicities such as pneumonitis and colitis and dermatitis because we're combining the two therapies together. So as nurses, we need to be very aware of what these toxicities are and how combining the two together can potentiate these side effects in patients. So immunotherapy plus or minus radiation therapy is very new. It's very novel. So adding radiation therapy to the mix, there's about 100 or plus clinical trials going on right now to see the benefits, the timing of the radiation, the dosing of the radiation, what tumors will be more effective. So in the future, I see, just like we do with chemo and radiation, I see the combining of radiation and immunotherapy. You're going to have a sort of an immunoradiosensitization. So immunotherapy will sensitize the radiation to become more effective. And radiation also will cause the immunotherapy to also be more effective. So your future is going to be the combination of the two agents, whether that's concurrently, whether that's in an adjuvant setting. We're not sure yet. That's what the clinical trials are for. I think one of the big questions that people have is, when you're using immunotherapy in these patients and you can elicit certain side effects, immune responses, where does the role of steroid therapy come in to these patients? Radiation therapy can cause a lot of inflammation, especially if you're treating something like a brain tumor. You can have a significant amount of inflammation, which requires a dose of steroids in these patients. But being on immunotherapy, you don't want to give the steroids because you don't want to immunosuppress. So a lot of the big questions is, what is going to be the interplay between dealing with the side effects from radiation therapy but not suppressing the immunotherapy? The take-home message is immunotherapy is very effective, but it can be even more effective with the addition of radiation therapy. The two work very synergistically. One will definitely enhance the other, and what you are going to see is a future of radiation and immunotherapy combined.